Hello class, welcome to Chapter 19. This chapter is entitled Into the Future Trends to Watch. So here are the learning objectives, so review those now and later. Let's take a look at the challenges met. The field of long-term care has gone through and is still experiencing a time of great change. Some challenges have been met, at least in part. The desire of consumers to receive care in the most appropriate setting and the desire for a high quality of life have led to development of more and better alternative services. Institutional care providers have done much to make their facilities more home-like and conducive to a high quality of life. Integrated health services and networks have affected how care is delivered, the cost of delivering it, and the way it is used by consumers. There has been progress in allowing consumers to have more say in their care. We have also seen a move towards culture change, which is supporting the creation of environments where residents and their caregivers are able to express choice and practice self-determination in meaningful ways at every level of care. Some of the solutions created new challenges. As government and private corporations began to experience health care expenses beyond their ability to cover, they found relief in the form of managed care. The rise of managed care presented the long-term care system with other problems. Providers have had to pay much more attention to the cost effectiveness while trying to maintain high quality. They have had to face complaints, and managed care organizations, which we know as MCOs, put cost savings ahead of the quality of care. Integration of services has been a positive step overall, but it has been fatal for some providers. Creation of new services has created additional demand. Other challenges of the recent past still show little, if any, resolution. The long-term care system is still essentially reimbursement driven. The services received depend somewhat on the reimbursement available. There is still more demand for service than there is money to pay for it. Access to and availability of long-term care services continue to be areas of shortcoming. Services are not distributed equitably for a variety of reasons. Future directions, where the system is likely going and why. Changing consumer demographics. The demographics of long-term care consumers have been changing faster than the system has been able to adjust. The aging society. The growth in the number of elderly will be a driving influence on the system for years to come. The number of elderly, that's people 65 and older, is projected to mushroom to 70 million by the year 2030. That's nearly twice what it is today. The group who are 85 and older will increase by at least fourfold. And when we refer to the group of people 85 and older, we're referring to that new life stage called the oldest old. And people have not been living this long in the past, so we don't know a lot about them. People are living longer for a number of reasons and will continue to do so. The longer life is due in large part to the improved quality of the medical care they have received. Many of the diseases that killed people as children or as young adults have been effectively eradicated. Two of the greatest killers in recent years, heart disease and cancer, have declined. Longer life can also be attributed to changes in people's lifestyles. The third reason for the growth in numbers of elderly is the aging of the baby boomers. Their impact over the next couple of decades will be more significant than any other population cohort seen to date. They are more likely to be open to better education about the system and learning how to use it wisely. The impact of the aging of society on long-term care will be twofold. It will extend the time over which the elderly will require long-term care services, and the elderly will continue to use acute care services, but not significantly more than at the present. The need for acute services will simply come at a later age. Long-term care may be needed for many years. Let's take a look at an increase in chronic conditions. There will be an increase in chronic conditions as society ages. By 2030, half of the population will have one or more chronic conditions. The number of people with chronic conditions increases dramatically with age. There will be an increase in new diseases, actually existing diseases with new prominence. Alzheimer's disease, macular degeneration, osteoarthritis, osteoporosis, dementia of other causes, cardiovascular disease, and diabetes, to mention a few. Greater cultural ethnic diversity. The long-term care consumers are also changing in terms of their cultural, racial, and ethnic backgrounds. They bring with them different languages, different cultural practices, and some unfamiliar diseases. Cultural diversity is also bringing a need for providers to be more sensitive to different cultural practices. Diseases that have been largely eradicated in the U.S., such as polio and tuberculosis, have begun to appear as people emigrated from other parts of the world. A consumer-driven system. The most important descriptor of the future healthcare system is that it will be a system that is consumer-driven. Consumers of tomorrow will demand more choice in both the care they receive and in how their dollars are spent. Consumers of tomorrow will be better eradicated and informed than those of the recent past. They will be better able to make choices, and they will have more disposable income because they will be more conscious that they are paying for their care, either directly or indirectly. Consumers will want the ability to shop around. People who have adapted their lifestyles over the course of many years will want to continue those lifestyles as much as possible in their later years. They will look for care that is flexible and adaptable to their particular lifestyles, even extending to alternative medicine and self-care. Providers and payers will need to accommodate their desires. So let's take a look at focus on quality and outcomes. Consumers of long-term care are learning how to judge quality as it pertains to them and will continue to as they become better informed. They will judge the system and its providers by how they are affected. Quality concerns fall into three distinct but related categories. Let's look at quality of care. Consumers are concerned about the quality of care they receive. Studies have shown that quality of care is not equitable across the U.S. The ongoing media hype focusing on examples of poor care raises concerns. The frequent number of lawsuits in the news and concerns about the effects of cost cutting cause consumers to have their doubts about quality of care. Patient safety will assume new prominence both in acute and in long-term care. As consumers learn to demand more of their role in their care, they will become less and less forgiving of clinical errors or lapses in care. Payers will continue to insist on fewer errors, and providers have more tools to work with, such as technology, which can help them collect and manage relevant information to avoid errors. The government has taken several steps to ensure safety, including requiring that all skilled nursing facilities have sprinklers as part of their fire prevention and control systems, and a new concern for long-term care, at least newly realized, has come about because of the damage caused in recent years by hurricanes such as Katrina and Rita. Quality of life. Quality of life will assume a high priority with tomorrow's long-term care consumers. They want care that is either provided in their homes or in surroundings and in a manner that is as close to home as possible. Institutional providers have responded with amenities such as a la carte menus, home-like living settings, and flexible treatment regimens. Other adaptations include more flexible outpatient care and remote monitoring and safety call systems that allow more of them to actually stay in their homes. Consumers want more control of their lives and are willing to look around until they find it. So let's look at outcomes. Payers and regulators are beginning to understand outcomes measurement and will rely on it more in the future. They have previously focused primarily on process and structure, not outcomes. Both government regulators and private accreditation agencies are moving towards outcome-based quality measurement systems. They will gradually move from judging how care is delivered to assessing it based on what it accomplishes. Let's take a look at changes in the workforce. The long-term care workforce will change dramatically in the future. The trends to watch in relation to the workforce are growth and demand. Healthcare, including long-term care, is already one of the largest and fastest growing occupations. Aging in the workforce. The workforce is getting older, paralleling the aging of society in general. Many of them are baby boomers, since that is the largest age cohort we have. The post-baby boomers are a smaller group, providing fewer people for the workforce. Staff shortages. We are facing a serious shortage of staff to care for the growing number of elderly needing care. Blending of professional roles. If the kind of changes in organization and delivery that are foreseen here are going to be accomplished, there will have to be some breaking down of the artificial barriers created by healthcare professionals. This means moving from the traditional medical model towards more of a holistic model of care. Changes in the organization and delivery of long-term care. Let's take a look at this. There will be many changes in the way long-term care is organized and delivered in the future. No single delivery system is likely to emerge as the best system. Towards a seamless system of care. There is already significant movement towards a more seamless system of care. Increased demand and strain on resources that are already stretched to the breaking point will continue to emphasize efficiency. The demands of consumers for more choices in the types of care available to them will lead to a continuum that is more user-friendly, reducing much of the fragmentation and confusion that exists today. One of the most important elements of a seamless system of care is the melding of what are now essentially separate systems of healthcare and social support services. The degree to which the system of care becomes seamless will depend on advances in technology. Consumer-directed care. Consumers of the various forms of long-term care will expect to direct their own care as much as possible. A 2008 Medicaid rule permits Medicaid recipients to self-direct their own health care and supportive services. New living and housing options. Let's take a look at this. Long-term care providers have made significant strides towards meeting the needs of consumers for convenient home-like living situations. Co-housing, small house design, sustainable design practices, improved and enhanced amenity. Now, when we look at technological advances, perhaps the most significant and unpredictable factor in determining the shape of healthcare in the future will be the continued explosion in technology. Providers may find it difficult to keep up with the rapid changes in technology. Technology will also dominate how the healthcare system is organized and managed. Consumers will need to be provided with information accessible through technology, and future consumers are familiar with the use of technology. More and better clinical applications. Over the next decade or two, there will be new clinical procedures that we cannot even begin to imagine today. Innovative delivery methods. Coming decades will see a continuation and escalation of the changes that have occurred lately in how healthcare is delivered. New forms of care, changes in assessment methods and care planning, and efforts to become more consumer-oriented have all improved the lot of the consumer of long-term care. Special care units, there will be an increase in special care units designed to treat people needing highly specialized care. This could be our Alzheimer's population. Informal caregivers, the long-term care system will finally find ways to make better use of informal caregivers. Let's take a look at new organizational relationships. In trying to secure their share of a particular market, long-term care providers will find many new and innovative ways to deliver care. Among providers, integrated care systems will dominate because they will have the ability to provide more of the seamless system of care. There will be a move towards niche marketing. Providers of different types and levels of long-term care services will get together to meet consumer needs. There will be more internal organization along the lines of strategic business units, and between providers and payers, providers will find new ways to work more closely in partnership with payers. Both care management and case management will continue to grow. Institutional to non-institutional care, the shift that has been taking place from institutional to community-based or non-institutional care will continue. Efficiency, we will see delivery methods that are more efficient, that are more responsive to the needs of consumers without significant loss of quality. Providers will utilize technology to increase efficacy, and these changes will not take place easily if not properly supported by regulators and payers, especially the federal government. Changes in financing and reimbursement, the critical role financing plays in the delivery of long-term care will not only continue but will intensify. Overall spending on health care is increasing. Both public and private reimbursement sources will find it difficult to keep up. Decrease in employer-sponsored insurance. Employers are also trying to reduce cost, particularly in the recent economic situation. Public payers continue to struggle. Government payment sources are also finding it difficult to survive. Medicare is threatened with insolvency. Medicaid is one of the largest costs for state governments. They will continue to use managed care. Providers continue to struggle, due in part to the difficulties their most significant payer sources are having. Innovative financing. The future will also bring innovations in healthcare financing. The current trend towards capitation and other prepaid group contracts will continue and grow. Prospective payment will become the dominant form of payment for long-term care providers. We can expect a significant expansion of pay-for-performance initiatives. Public and private partnerships. The key to future financing of the healthcare system may well be public-private partnerships. Okay, let's take a look at ethical dilemmas. Both the number and scope of ethical issues that will arise and need to be resolved will increase. Life and death issues. Clinical advances have created additional issues concerning life and death. We can extend life much longer than before, and the issues involve balancing extended life with quality of life, balancing needs of consumers and providers, not making providers provide care not in keeping with their own beliefs, and as providers join integrated health systems, there may be a clash in values. Allocation of resources. Shortage of resources increases the difficulty of allocating them fairly, and that may involve having to provide services that are not financially viable in order to meet the needs of consumers. The Affordable Care Act calls for greatly extending coverage. Regulation will definitely increase. Regulation of quality and regulation of cost. Health system reform. The fragmented system needs reform, primarily financing reform. Government involvement, how much or how little? Most Americans want government to pay more but do not want them to run health care. The Obama administration achieved passage of the Affordable Care Act. Only time will tell how it will work out. So let's take a look at this summary, read the chapter, and then go ahead and review the learning objectives again. Thank you.